If you have chemotherapy into a vein, this will usually be done in the chemotherapy day clinic or on a ward. Depending on your particular treatment, the chemotherapy could be given through different pieces of equipment. One of the simplest is a cannula, which is a small tube inserted into a vein in the back of your hand or arm. After the chemotherapy has been injected, it will be removed before you leave the unit. Other devices, known as central lines, are put in place if you're getting long-term chemotherapy over several weeks or months, so as to avoid multiple needle sticks. There are a number of types of central lines that may be recommended, one of which is called a portacath. A central line is put into a vein in your chest through your neck or chest. This is a minor procedure under local anaesthetic that often takes about 30 minutes and will be in place ready for your course of treatment. Another type of central line is known as a peripherally inserted central catheter, or PICC. It goes into one of the large veins in the arm, near where it bends. One of these can be fitted in the hospital and can take up to an hour to fully insert the PICC. When completed, you will have several centimetres of flexible tubing on the outside of your arm, protected by a dressing. As with all long-term devices, your nurses will advise you on what movements are restricted so they are not damaged or moved accidentally after you leave the hospital. Usually, there are very few restrictions on your everyday life and you can bath or shower as normal, provided you follow straightforward precautions. Your nurses will also advise on other possible risks, such as irritation, which usually goes away after a few hours, infection, and blood clots, which are more serious. If you have any concerns about these lines when in place, then contact your team straight away. Whether you have a cannula inserted or a long-term device in place, the chemotherapy drugs will be delivered through it by injection, as a drip, or through a pump. The drugs can be injected directly into a vein through your cannula or central line over a few minutes using a syringe. Sometimes a bag of clear fluid is attached to plastic tubing and connected to the cannula or line in your vein first, called a drip. The drug is injected via a tap on the tubing and is flushed into the body with fluid from the bag. An infusion pump can also be used if you are receiving your chemotherapy drug through a line. Pumps allow for a slower, more controlled administration of your medication. The pump is small enough to be carried in a bag or belt holster. Having chemotherapy in the day clinic can take anything from a few minutes to a few hours if a drip is being used. When you receive your chemotherapy, your nurse may need to wear some protective clothing, such as a disposable apron and gloves, so as to avoid contact with or any accidental exposure to the drugs, as they can be harmful to the skin.